For the delay. Been a lot of substitutes, a lot of moving parts, so we're doing the best we can, and we're going to start off with a prayer from Senator Hatchett, number 4.
Number 4. Thank you, Mr. Chairman. Let us pray. Dear Heavenly Father, we come to you today and ask for your wisdom and guidance as we make decisions for the people of the state of Georgia. Please be with us. In your name we pray. Amen.
Thank you. Appreciate that. We have 10 bills today. The first one we're going to give more time, ample time, I hope, and then we have the other 9. I think are less controversial, and we do have some changes, and we'll note those changes as we go along. Most of them are not substantial changes. All of them are not substantial changes on any of the substitutes, or I would not have allowed them. So we are going to start off with Senate Bill 419. Senator Walker, if you come up right here up front is good as a member of the committee, and bring up your guest, and you're at it.
Mr. Chairman, thank you very much for giving me another chance to talk to the committee about this bill, or this topic. And I have with me today Megan Brass.
Good afternoon. My name's Megan Brass. I'm a certified registered nurse anesthetist, and I'm representing the Georgia Association of Nurse Anesthetists.
Mr. Chairman, this is a topic we heard last year in your committee, had a lot of discussion over. Ultimately, it was tabled. I introduced a new bill this year because the bill last year, which was Senate Bill 102, we had a sentence at the end, an anesthesia administered by a certified registered nurse anesthetist pursuant to this code section shall be considered the practice of nursing. We struck that sentence. It really did not add anything to the bill. So then I came with Senate Bill 419, and as you would know it, then I actually asked for a substitute to strike the dentist from the bill. And so I have, which I hope you all have, LC 520501S.
That's what I have. Just to make sure everybody's in their committee folder. LC 520501S. All right, I don't see anybody saying no to that, so if you proceed on. Thank you. And just for clarification for the committee and the people watching, the only change in the substitute was removing a dentist from this, correct?
Correct.
That's what I'm saying, no changes of significance there.
Yes,
thank
sir,
you.
and thank you for accommodating that. The reason I'm so persistent on this issue and really become passionate about the issue is I represent 5 hospitals. 3 of my hospitals do not have a anesthesiologist on staff, and so they rely on the services of CRNAs for their administration of anesthesia during surgery. In fact, they use what I would call in the old Methodist tradition, kind of a circuit rider. There used to be circuit rider preachers. They use what I'd kind of describe circuit rider surgeons oftentimes, and it's becoming more and more difficult for them to hire surgeons or contract with surgeons because they fear the liability that they incur by the way our code is written on the responsibility and direction of the anesthesia. This is not a scope bill. This is simply recognizing what is practically happening in the vast majority of our counties in Georgia. We have over 80 counties that do not have an anesthesiologist, and so the CRNAs are working under an order by a physician, so a physician is always involved in this process. But when they get in the operating room and they're checking the vitals and making sure the patient's breathing right and administering the anesthesia, the surgeon is not directing that activity. And the surgeon does not want to be in a court found liable for directing that activity. That's the responsibility of the trained CRNA. So we are asking that we strike under the direction and responsibility of, because as I just described, the surgeon's focusing on doing the surgery. He's not looking behind the sheet or whatever and checking the monitors and the vitals and all of that. The CRNA is doing that. So this is just to clarify the distinction of the responsibilities of the two parties. The surgeon orders a CRNA does not have a DEA number, and so they're not ordering the anesthesia. I mean, the surgeon is seeing the patient, or the physician involved is seeing the patient and checking them out to make sure they're healthy enough for surgery, et cetera, and ordering the anesthesia. But once the surgery starts, the administration of the anesthesia is the responsibility of the CRNA. Lastly, Mr. Chairman, this was the number one recommendation that came out of our Senate Rule Medical Personnel Recruitment Study Committee that was established by SR 371. It was also a recommendation from the governor's office he had like a blue ribbon commission, I don't remember the exact name, on a healthcare workforce shortage and how to address that. So that's where I'm coming from on this.
Thank you, Mr. Chairman. We appreciate that.
Thank you.
Why don't we do this? Why don't we have people that testify, and then we'll circle back with committee has questions, and we'll
Okay.
go from there.
I don't
Is that
know.
okay?
Yes, sir.
Okay. What we're going to try to do is hold everybody to 2 or 3 minutes on each side. We'll be the bad guy this time. Anna Adams speaking for the bill, and Tim Davis to follow her. I'm sorry. It's on now. Sorry.
Thank you. Thank you, Mr. Chairman. Members of the committee, I'm Anna Adams with the Georgia Hospital Association, and we are proud to support this legislation. Many of our rural hospitals, as they think about ways to provide access to care for their local communities, have to think about what providers they have who can provide those services. And when considering whether to be a trauma center, when considering whether to deliver babies, having access to anesthesia services is a number one personnel consideration that they have to make sure that they're focusing on. We think this legislation does not really impact scope of practice because these CRNAs are already providing this service, but rural areas have an easier time accessing CRNAs than they do anesthesiologists, and so it really provides additional access for patients in those areas. We'd like for our rural hospitals to be able to continue offering those services, and this is an option to allow those providers to practice at the top of their scope in education.
Thank you, Ms. Adams. We
Thank
appreciate that. Tim Davis, if you just identify yourself. GNA stands for Georgia Nurses Association.
Thank you, Chair. My name is Tim Davis. I'm the Senior Director of Government Affairs at the Georgia Nurses Association. We're the largest organization representing nurses in our state, and we rise to express our support for the bill. As has already been alluded to, this bill just streamlines the process for our rural health care and hospitals and allows them to be able to conduct surgery even if they can't employ an anesthesiologist. And so we would ask for your favorable consideration at the right time. Thank you.
Thank you, Mr. Davis. Okay. Somebody want to give it? Yeah.
Your job is to put me to sleep and wake me up. Who gonna have the insurance in case something go wrong to take care of my family?
Sure.
Just identify yourself and
Yeah,
we'll
sure.
go.
Megan Brass, certified registered nurse anesthetist. Yes, sir.
All right. Who's gonna have the insurance in case something go wrong?
Absolutely. So that's a great question. Certified registered nurse anesthetists carry the same medical malpractice policies that physician anesthesiologists do. They are $1 million, $3 million policies. And so if there's something that happens during a case, I have the medical malpractice policy that I need, and that's required by me to practice, that would help cover.
All right. Thank you, Mr. Davis. Appreciate that. Thank you for the question. Dr. Bobby Kaufman. And then Dr. Amanda Brown. Everybody's being efficient with their time. We appreciate that.
Hi, I'm Dr. Bobby Kaufman. I've practiced internal medicine for 35 years. I'm here to speak against the bill. I have a personal issue and medical issue. I understand CRNA's role, and I think it's an important role. But the problem is that not every case is easy and simple. 4 years of med school, 5 to 7 years worth of training is different than what a CRNA goes through. And this personal side, my nephew, 30 years old, was getting an endoscopy, aspirated and died on a simple procedure. My sister is obviously very angry about that and was upset with the CRNA. And I said, it's not, she didn't wake up that morning and want that to happen. But unfortunately, she didn't have backup and wasn't prepared to handle this type of emergency. So I feel strongly that you do need medical coverage for backup. Thank you.
Thank you, Dr. Kaufman. Dr. Amanda Brown. And then it's Dr. Corey Ford.
I'm grateful for the opportunity to speak today. I am a physician anesthesiologist practicing previously in Macon and now in Atlanta. I stand before you as a physician who has practiced in Georgia for the majority of her career. I devoted my academic career to studies at preeminent institutions, attending Mayo Medical School, Johns Hopkins, and then the Children's Hospital of Philadelphia. I draw on that training daily. Those midnight hours in Baltimore and Philadelphia, resuscitating patients across the age spectrum, from infants to the elderly, making the decisive calls, directing the ICU nurses, the totality of that experience informs my presentation to you today. I ask this committee to understand that Senate Bill 419 irrevocably changes Georgia code. The bill severs the physician-patient relationship. It removes the physician from the patient in crisis. A person, when rendered unconscious and subject to the trauma of surgery, is incapacitated. They lose all agency. Under current law, if the patient has a cardiac arrest, the directing physician has a relationship with the patient and is immediately available. Senate Bill 419 changes this. Senate Bill 419 says that a physician, podiatrist, or dentist without any geographical relationship to the patient can order anesthesia care. This means that a physician practicing in any state, but just happens to carry a Georgia license, can direct the care of a patient in Macon, Albany, or Gainesville, whether they're in Atlanta, Texas, or California. In the event of a lost airway, a toxic drug effect, a major hemorrhage, phoning someone in California will be of no use. Dialing 911 would be faster. Last year, a physicians group in Texas asked if their doctors could order anesthesia by CRNAs in Georgia. Thankfully, both current Georgia Code and the Georgia Medical Board resoundingly answered no. The clinical care of anesthesia is at its essence critical care. These high acuity environments necessitate a team, a high-functioning team, a responsible one. In moments when oxygenation is lost, fetal heart tones decline, or cardiac arrest occurs, discussions are terse, rapid, and informed by the physician and the nurses in the room. When it's your neighbor, your parent, or your child, you want both the physician and the nurse immediately available. It is a basic tenet of medicine that rescues from cardiovascular collapse are made in seconds, and not by paper, in the form of an order from someone out of state. It's problematic that rural and underserved populations are a bargaining tool in this debate. Patients in rural hospitals often have the least access to resources, and now administrators are saying they aren't worthy of a
Dr.
physician
Brown,
in their
sort
care.
of running, you're
Thank you.
wrapping it up.
Yep.
Thank you. And Dr. Corey Ford, and then Dr. Quadre. Gotcha. Okay.
Good afternoon. Thank you for allowing me the opportunity to talk about this important legislation. My name is Corinne Ford, and I'm the current president of the Georgia Society of Anesthesiologists, as well as a practicing cardiothoracic anesthesiologist at Emory University. But I'm also a patient, and I'm a mom. Throughout my cancer treatment and numerous procedures, I had a physician anesthesiologist in charge of my care in the operating room. When both my children had their tonsils and adenoids out, we had an anesthesiologist in charge of their care. The operating room can be one of the most critical care and the critical care situation a patient undergoes, and using the team approach with a physician in charge, sharing information with the surgeon and anesthetist is the safest way to care for these patients. Removing physician involvement in no way advances healthcare. It moves the needle dangerously backwards, creating healthcare delivered at two distinct tiers, the ones that have a physician backup and the ones that don't. Georgians deserve better. If your child, grandchild, mom, or brother was having a surgery, whether it was life-threatening or not, would you want a physician in charge of their critical care while they're under anesthesia? All patients deserve physician-led care. All Georgians deserve physician-led care. My experience, both personal and professional, causes me to ask you to vote to defeat Senate Bill 419. Thank you.
Thank you, Dr. Ford. I'm going to let you pronounce your name.
Thank you. My name's Yawer Kadri. It's a case I don't know
Thank you,
you.
Dr. Kadri. And Jet Tony's last.
Sounds good. I'm a assistant professor of anesthesia and practice here at Atlanta at Emory as well. I, however, do more on the interventional pain side. And again, the scope of anesthesia is broad, and as a board of director member of the Georgia Society of Interventional Pain Physicians, we ask you to vote against this. Our worry is primarily that anesthesia coverage seems to be well handled, but if you broaden the scope or accessibility of anesthesia services, a doctor can order a epidural, a simple injection, a nerve burning procedure that would be performed by a nurse anesthetist without supervision. Those procedures come with a lot of risks. They can be done safely with supervision and guidance, but we worry about what that could lead to for our patients. We also worry about the other things that come along with this. One of the big things these days is something like a ketamine infusion clinic. There's a lot of these in the state and more coming. Some of these are owned wholly by CRNAs already, but have at least a medical director supervising them. This bill would, in theory, allow the proliferation of that, and we don't want to open up the doors to another epidemic of unsupervised administration of medications that cause hallucinations and psychosis in folks. Overall, again, while we think this could be useful for access, we don't think it helps to take the co-pilot out of the cockpit here. It's reasonable to attempt, but it may lead to more harm. And so our group would ask you to vote against this. Thank you.
Thank you. Mr. Tony.
Thank you, Mr. Chairman, members of the committee. Jet Tony, representing the Georgia Society of Anesthesiologists. So I want to address what this bill does not do. It does not add one anesthesia provider in the underserved areas of Georgia. And in fact, CRNAs, anesthesiologist assistants, and anesthesiologists, the three anesthesia providers in this state, are highly regarded, highly needed, and are practicing everywhere where surgical activities are being conducted, whether it's rural or metro. In fact, every employable anesthesia provider in this state who wants to work is working. This bill doesn't add any more anesthesia providers. In fact, it will reduce the number of anesthesiologists who are hired by hospitals. And let me explain how I can be confident saying that. So the author of the bill spoke about the hospitals, some of the hospitals in his district that do not have anesthesiologists. But what very likely will happen in Houston County, where there is a 6-physician and multiple CRNA anesthesia practice covering both hospitals, that hospital administrator at some point is going to say, wow, with this new bill, we can get rid of the anesthesiologist. And you say, well, Jet, that may be far-fetched. No, the Hospital Association just told you that they want options for reducing their costs. And this bill is an excellent boon for the hospitals who want to reduce their number of anesthesia providers, particularly the anesthesiologists. Now, I'm confident in saying all this because I know for a fact that a mid-sized city hospital in this state has already taken this bill in a contract negotiation with the anesthesia group, waving it in their face and saying, if you don't come down on your contract price, we're going to go all CRNA, no physician anesthesiologist. That is going to be what will happen in hospitals all over the state. Now, we know from experience and watching in other states what occurs. The best hospitals will keep
got 30
physician
seconds, please.
anesthesiologists. Hospitals that want to cut expenses and shortchange patients will run off their anesthesiologist. And you need that upper level care for the patients provided by physicians. Thank you, Mr. Chairman.
Thank you, Mr. Tony. Floor is y'all's. Last word, and any questions at all, then we're going to take a vote.
Thank you, Chairman. Again, over 80 counties have no anesthesiologists. The hospitals I'm speaking to about in my district, they can't hire anesthesiologists, and anesthesiologist doesn't want to locate there because they can't make as much money as they can in the more populous areas of the state. They've been having successful surgeries and have great hospitals and great care and great outcomes using the CRNA model. This simply attempts to make it clear that the surgeon is not legally liable for actions of the CRNA, so that these hospitals can continue to perform surgeries, continue to offer that service, and be able to hire surgeons. Otherwise, they're telling me that they're going to have to quit offering surgery if we can't find a solution to this. And I'd like Megan Brass, who knows the business inside and out, to kind of close it out for me, if you don't mind, Mr. Chairman.
Perfectly fine.
Thank you, Senator Walker. So I know y'all have heard a lot about anesthesia providers and the relationship between the anesthesiologist, the nurse anesthetist, and the surgeon. But I'm here to tell you, and from the mouth of the horse, as we all heard in Augusta, the head of anesthesiology at Augusta University and MCG's hospital said verbatim, anesthesiologists do not go to rural Georgia because the payer mix there cannot reflect an income that they want to keep. So I don't know about y'all, but myself, the nurses in Georgia, and especially the APRNs, are getting very tired of being villainized by organizations like MAG when we are the ones in rural Georgia, we are the ones in the trenches, and we are the ones taking care of those patients. We are bringing solutions to the table, and all we are hearing from them is no.
Thank you. Any questions from the committee? No questions. I'll be happy to entertain a motion. Got a motion to do pass. Have a second. Do pass from Senator Hatchett, Senator Hodges. Any further discussion? All those in favor, let's raise our hands. Those in favor of the bill. 1, 2, 3, 4, 5. That's 5.
You have to
5, 6. Got 6 for it. And all those against the bill. 1, 2, 3, 4, 5. Senator Lucas, you got to vote? Okay. All right, 1, 2, 3, 4, 5, 6. That's tie. I'm going to vote against it. Bill goes down. It was down last year, and I'm voting against it this time. It just went down.
No, it just didn't pass, so it's still on the table until.
No, it was 7-6. Yeah. The bill went down.
Can you second it? In 3. Okay.
As the chairman of the Rural Healthcare Study Committee, one of the issues that we faced in Habersham County was our hospital closed, had to close, but was taken over by Northeast Georgia. One of the main reasons they cited was because they couldn't get anesthesiologists in Habersham, and that way they couldn't get surgeons, so we couldn't afford to keep our hospital open. This is a good bill for rural medicine.
Anybody else? All right. Number 9.
Senator Walker, you mentioned liability issues and a surgeon.
from a practical standpoint, if there's a surgeon in the room and a nurse, and the patient has problems, I mean, the surgeon's not going to walk out of the room and leave the patient there.
No, sir. So the surgeon's gonna evaluate the patient, come up with a plan, find out what's wrong with them, decide what surgery to perform. He's gonna order the anesthesiology. He's gonna be in the room when the surgery's going on. If the patient went into cardiac arrest, he's not gonna run out, I don't think. But the way the code is, it says he's directing and responsible for the anesthesia, and the surgeons don't want to be.
It is the anesthesiologist that is responsible for that patient during surgery. And we didn't, thank you, we did not do a motion to reconsider. We did a motion, got a second, and we did not vote on that, whether to reconsider or not. Okay, I'm sorry. I let the discussion be. So we have a motion to reconsider. All those in favor of reconsidering the vote? 1, 2, 3, 4, 5, 6.
I need you, Luke.
Lucas, is that a vote, yea or nay?
I want Medicaid expansion.
Okay, all right. 1, 2, 3, 4, 5, 6. 6 to reconsider. All those not to reconsider? Not to reconsider. 1. You got to vote if you're at the table. 1, 2, 3, 4, 5.
What's it vote?
Is that a vote to not reconsider?
I'm not reconsidering.
Okay, not, so that's 6 again, and then that's a tie, so I vote not to reconsider. Okay. We're going to move on. Thank you. Thank you very much. Appreciate it.
We need Medicaid expansion.
I got you. I understand. All right, so the next bill is Senate Bill 455. Senator Strickland, you can do it from your seat, you can do it from there, but before we get started on that, I want to make sure that, number one, we're dealing with the right LC. There is no substitute on this one, LC 339618. But the next bill of yours is a substitute, and I want to make sure we're dealing with the right one on 456. Supposedly, this is correct, right? LC 339673S.
No, that's not a second. Wait, is there a new one? I'm sorry. That was.
For the next bill or for this bill?
No, I'm sorry. Here we go. We wrote it. Got a little dyslexia up here. We're good.
This is the LC for.
Can you start on mic 2?
Yeah, give me just a second. The next one is, I want to go ahead and do this in advance. LC 520505S is the next one, 456. So if everybody can make sure they have that in your folder.
I have all of Sarah sent us all the LCs in her order. These are all of our LCs.
Okay. We all good? Okay. I'm ready. We are at... We are at Senate Bill 455. We already did the LC. The floor is yours.
All right, thank you, Mr. Chairman. Senate Bill 455, speaking of Medicaid, this comes from DCH. It's Department Bill, putting my Medicaid attorney hat on, which doesn't fit very well. All this bill is doing is codifying something in Georgia Code that's required by the Federal 2022 Appropriations Act when it comes to third-party payers. Of course, Medicaid is a payer of last resort, and so when there's other parties involved that are paying claims, this just confirms, as the feds now requires to do, that we have to have language in the code that says that once Medicaid approves a payment, once the state has, I guess I'd say the department has approved a payment, that is approval for the service, and a third-party payer can't use their own inability to authorize to deny payment. And that's all the language is doing there on lines 26 through 30. Line 31 through 32 also codifies the process where a third-party payer must respond to the department within 60 days of receiving an inquiry as to one of these claims as well. I do have one change I'm going to ask to this bill in speaking with the department, and that's on line 26. The word authorization should instead be line 26, except the department's payment. That word should be payment. Apparently, the way we wrote that, we have authorization again on line 28, but it should say except the department's payment.
what you're proposing when we get there. Line 26 should read 2, accept the department's payment, and we'll be striking the word authorization.
That's
and
right.
the rest of that will be the same 4, and this struck a health care item.
That's right.
That was it?
That's it.
Okay. Any questions on this bill? Certainly. Hold on just a second. 9?
9, please.
Okay.
Maybe I missed it, but there's a 90-day provision on the first page and a 60-day provision on the second page. What's the difference?
You know, the caption may need to be corrected to say 60.
Is it 60? Is
Yeah, is that,
that caption?
Yeah, that's the error.
I think that's the error in the caption.
Okay, all right.
Good catch. You
Ms.
must be on
Critton.
the Judiciary Committee. Am I correct? Ms. Crittenton should.
Yeah,
so
it does say 90.
That's the
Is that-
second amendment we would need to make.
Ms. Crittenden, is that correct? Okay. I don't think that portion, so on line 6, instead of within 90 days, it's going to say 60 days. Good pickup. I don't think that appears in the bill, though, does it? It's not law, but it's a preamble.
Should we
Okay.
still correct
It
it
is in the
though?
bill.
Okay.
We'll correct it, we'll make it look
Line
good.
32? Still correct. Line 32?
Well, it's still within 60 because it's 90, but yes. Let's not get more confused. than we
32
already
is supposed
are.
to be 60. Okay. And nobody signed up to speak for this. I think that's accurate. And any further questions or amendments or changes or anything?
Do we need to formally do an amendment?
Yeah, I want to make sure we got no questions, discussion, and then I think so the posture we're in is I'd like to take a motion, accept a motion. Move do pass. Second, Senator Orrock. Do pass was Senator Setzler. And so I'll entertain, so we're talking about amending Senator Strickland on line 6, changing 90 to 60. And then on line 26, changing the word authorization to payment. Everybody clear on that?
Just on line 26.
Just on line
The one on
26.
28 should remain.
Yeah, that one's accurate.
All right. Have that amendment, Senator Eccles, so moved. Second, Senator Kirkpatrick. All those in favor of the amendment, say aye.
Aye.
All opposed, like sign. Now we're moving to the big bill, to the bill itself. All those, any further discussion? No. All those in favor say aye.
Aye.
All those opposed, no. So that was LC 339618 as Senate Bill 455.
We'll get a new LC.
We'll get a new LC, that's right. Senate Bill 455 by committee substitute. All right. Thank you, Senator Sessom. And let's see. All right, there we go. All right, so next one, 456, same author, Senator Strickland.
Thank you, Mr. Chairman. Also coming from DCH, quick history on this. Back in 2018, my first year in the Senate, last year, Governor Deal's term, I carried a bill that created a caregiver registry with the main purpose of it was to create a process where we can have people fingerprinted through national fingerprint database background checks to know who's working with people on long-term care facilities. Part of that also allowed certain private individuals to also take advantage of this registry, and you're caring for someone privately and you're hiring someone to care for an elderly person. At the time, there was a request to also include disabled people. It just said elderly persons, and we decided to hold off to give this program time to get going. And now here we are, 6 years later? And we are wanting to add disabled persons to this. And so what it'll do is allow private individuals who are caring for someone that's disabled to also use this state registry to verify who's working with the disabled person. They could be an adult, they could also be a child. And one of the important things someone pointed out to me, someone that has dementia, under the current law, until they're 65, you can't use the registry. So now someone with Alzheimer's or dementia could use it or have their family member use it when looking at background checks for them. There was also a request to include those that work under a Medicaid program. And you'll see lines 36 and 37, the substitute, as also employers, folks that are using that structured family caregiving program that can also take advantage of this. I noticed one addition we need to make to the bill on line 25. On the definition of applicant, it should also say or disabled person. And so we would add between elderly and person or disabled. Unless Senator Hodges found more mistakes or disabled, that may be the only mistake we made on
We're
this.
on line 25?
Yes, sir.
Okay. Where it
That's the
says
bill.
elderly person or disabled.
Or disabled.
Disabled person.
Elderly or disabled person.
Okay, so we got, all right. Anything else? Anybody else? Nobody signed up to speak on this. This is a department bill. We'll be happy to entertain a motion. Motion do pass, seconded by Senator Hatchett. It's Kirkpatrick Hatchett. And then any further discussion? No further discussion. So we're going, first of all, we're going to do the amendment, which is just one line 25 after the elderly person will be or disabled person.
It would, elderly, you would add or disabled. So it'd say elderly or disabled person.
Oh, that's right. Yeah, don't need to put person in there twice.
Right.
Okay, elderly or disabled person. And everybody clear on that? Okay, so did I get a, we'll do the same thing? Propose the amendment, Senator Strickland, seconded. All those in favor of the amendment, say aye.
Aye.
All those opposed, like sign. Now we're going to Senate Bill 456,
By substitute.
substitute, and 456. So all those in favor, say aye.
Aye.
All those opposed, like sign. It passes unanimously also. Okay. So we're at 460. Senator Dixon is not, yes, as he comes around the corner. Okay. And we do have two people signed up to speak. The floor is yours. We're at 460, and we don't have a substitute, correct? LC 520393.
Sometimes I know
Floor is
mine's
yours.
fault.
Thank you, Mr. Chairman. This is a very simple bill, and thank goodness it is, because I'm not a physician. I'm just a dirt guy. I did stay at a Holiday Inn Express once, but no, this is a good bill. Currently, a physician, they can have up to 8 nurses, 4 being APRNs, and then 4 being PAs. This bill would just allow a physician to have flexibility. It would keep it at 8, but they could have, 7 APRNs and 1 PA, or vice versa, just giving them more flexibility depending on what area of medicine they practice in. And then also in rural Georgia, I know that sometimes it can be harder to have, that balance, and just gives physicians that flexibility, but be happy to answer any questions.
And especially emergency room physicians, whether you have 4 and 4 or 2 and 6, that combination would make it ease of care from that perspective. Any questions from the committee? We do have 2 people that signed up, Tim Davis, Georgia Nursing Association, and Sheila Humberstone. You can just say you're for it if you want to, or...
Thank you, Chair. Again, my name is Tim Davis with the Georgia Nurses Association. We rise in support of the bill. Thank you to the sponsor for bringing it. Would ask for your favorable consideration at the right time.
Thank you. And she waves, and she is for it, and thank you. Appreciate the time management aspect of that. I'll entertain a motion. Move do pass, Senator Setzler, seconded by Senator Orrock. And any further discussion? All those in favor say aye. Aye. All those opposed, like sign. Pass unanimously. Thank you. So we are now at Senate Bill 480. Senator Hodges, you can keep your seat too from a time standpoint too. You got 480 and 481, and you're on not a substitute, LC 339611. Floor is yours. Let me get your mic.
That's right, number 9, 339611. Both of these bills are regarding the Georgia Board of Healthcare Workforce, and I have with me Chet Basine. You might introduce yourself, please.
Good afternoon. Thank you for having me. Chet Basine. I serve as the Executive Director for the Georgia Board of Healthcare Workforce.
Okay. And, Mr. Chairman, Senate Bill 480 basically is a bill that helps direct mental health workers to underserved areas. It provides for loan repayment of student debt for mental health and substance abuse professionals providing services to underserved youth in the state or practicing in unserved geographic areas or communities in the state that are disproportionately impacted by social determinants of health. That would be as determined by the board. To be eligible, you got to be a legal resident of the state. You got to be licensed mental health or substance abuse professional. You have to apply to the board. You have to have existing student loan debt, which is not in default. The Board of Healthcare Workforce will set the rules and the regs and approve applications. The maximum amount of money you can get is the amount of debt that you have. It's paid back in maximum of 5-year annual installments. To be eligible, you must remain Georgia resident, you must maintain your license in Georgia, and you must perform services in areas designated by the bill, and this bill is contingent upon appropriation funding.
Thank you.
You want to add anything, Chet?
No, you did a wonderful job.
All right. Basically, it extends the loan repayment serving in a rural area. It extends it from physician, nurse practitioner, now to mental health professional, right?
Right, absolutely.
We have a question.
Mr. Basine, isn't it true that the existing service cancelable loan programs have been very successful at keeping healthcare professionals in areas where we need them?
Thank you for the question, Senator Kirkpatrick. I do believe you are correct. We find that our loan repayment programs, we do operate them for physicians, dentists, nurse practitioners, physician assistants. Those are our legacy programs. And then in this current fiscal year, we brought online a nurse faculty loan repayment program, and then another program just for physicians where it's similar to this, where it's a multi-year commitment, so that somebody who is considering going to a certain part of the state knows that the state is there with funds for a duration, so they're comfortable relocating if that's a consideration. So to answer your question, yes.
Very successful program, Central Iraq, number 11.
And Mr. Chairman, I didn't mention this, but I should have. This is not a governor's bill. Okay.
Thank you. Thank you, Mr. Chairman. Thanks, the author. I just had a question. People are excluded from accessing this if their loan is in default. And I just wonder, just explain to me then what it means is not in default at the time of application for repayment. And this was at line 33.
Well, it's my understanding that all the rules and specific rules and regulations would be promulgated, would be set by the board and promulgated. So what defines default would be part of the rules and regs that they promulgate. But I think the sense behind this is if somebody has problems taking care of their student debt, that we shouldn't be paying it back for them.
Well, I would submit, and those that administer this program and looking at the data and going forward, to look and see, isn't that a very high needs person that would be very interested in accessing this approach and coming to rural Georgia to do these healthcare services? It's just, the question is, are we closing the door on a population that might well serve in rural Georgia? That's
Thank you for your question.
observation.
We appreciate that. Number 4.
Yeah. So my understanding of the program, correct me if I'm wrong, is it's year for year, and the forgiveness happens after the year of service, and it doesn't apply to loans that have happened before the person got there. Is that accurate?
If I understand your question correctly, Senator Kirkpatrick, the way this would work, I'm just going to say it is, it's a multi-year commitment that we would come up with through rules that would be promulgated. We do make the loan repayments in arrears, so they do the service period, then we then make the payment, so that way we are not in the business of chasing after somebody because they perhaps aren't practicing where they said they would be. And that is problematic, and it does take up some resources when we're in those situations.
Thank you. Any further questions? If not, I'll be happy to entertain a motion. We have a motion from Senator Kirkpatrick, Senator Hatchett, number 2. Any further discussion? All those in favor, let's raise our hand. All right, that's unanimous. Thank you. Okay. You're still up.
Okay,
So
so-
we're on Senate Bill 481.
Thank you, Mr.
And
Chairman. Senate
nobody
Bill-
signed up for either one of these. Certainly have Mr. Brasine as the expert here. We appreciate that. The floor is
Okay,
yours.
Senate Bill 481, LC 339610. This is an, excuse me, this is an agency bill. And this basically provides for the establishment of the Georgia Healthcare Professionals Data System. It allows collection and dissemination of non-identifying descriptive data on licensed healthcare professionals in our state. Information would be accessible to the public through the Healthcare Board's website. It provides information on demographic and geographical distribution of licensed healthcare professionals in the state that contains absolutely no individually identifying data. This data would be obtained from the bill calls for the various licensing boards to work with the Healthcare Workforce Board to get this data. Basically, you'd be looking at the data would be age, race, gender, ethnicity, location of practice, and license type. So basically, if you are in Hayhire, Georgia, and you want to know if there's an African-American OBGYN available, you'd be able to go to the website and find that out, not by name, but by type of provider. Also, this legislation allows the board to seek funding, grants, et cetera, to help those sources to help create, support, maintain this list. Anything?
Again, wonderful job.
Okay. Any questions from the committee? Well, I'll entertain a motion. Senator Kirkpatrick and Butler, second. Any further discussion? All those in favor say aye. Aye. All those opposed, like sign. Passed unanimously. Thank you, Senator Hodges. And Mr. Brasine, thank you for being here with us.
Thank you for having me.
We're moving on to Senator Brass. And there is a substitute, LC 339673S. And the floor is yours. Okay.
Thank you, Mr. Chairman. Again, working off of LC 339673S. Current law allows hospital pharmacies to apply to the Board of Pharmacy to increase the ratio of 4 technicians per pharmacist. And so what we're doing is this bill will allow all closed-door pharmacies to make that same application. I'll yield the balance of my time for questions.
Thank you. Would you define closed door and open door?
Sure. So open door is you can walk into the pharmacy. Anybody can walk into any pharmacy. So like let's say CVS or Walgreens, you can walk in there and get your prescription filled. Closed door is maybe a fulfillment center where you can't just walk in and get your prescription filled.
Right. And that's basically it. It's sort of a in-between
intermediary. Hospitals
hospital.
are considered closed door pharmacies.
Right. I just for the audience and everybody on the committee.
Mm-hmm.
Any questions for Senator Brass? All right, I'll entertain a motion. Mr. Dupass, move Dupass, Senator Setzler, Hodges. Any further discussion? All those in favor say aye. Aye. All those opposed, like signs. Passes unanimously. Thank you, Chairman Brass. All right, so we're on to turning the page.
Oh, we got another page.
All right. Senate Bill 495. The other much younger, much more handsome Senator Watson. All right, from the 11th.
Thank Members of the committee, good to be here. This is LC 365729. This is dealing with our low THC oil registry identification cards and the delivery of the cards. Current law requires individuals who qualify for these cards to go to the local Department of Public Health to pick them up. And basically what we're doing here is we're requesting that the department allow for these cards to be mailed to the people that qualify for these cards. Currently, we're mailing our driver's license to people across our state, and as you can imagine, individuals that are using this product may be obviously sick or in a nursing home or elderly or have some issue that prevents them from being able to drive and physically get to the Department of Public Health to show their ID and pick up their card. So that's what we're doing in the bill, and I'll be glad to take any questions.
Pretty straightforward, done by UPS or a secured electronic means. We have two people who want to speak, and it has to be done by UPS electronic means because of HIPAA. It's not just like your driver's license, even though that should probably be protected too, but privacy issue. Senator Kirkpatrick.
So are we saying that only the U.S. Postal Service could be used?
No, the bill's UPS, right? Oh, no, it is United States Postal
Yes.
Service.
The current version is UPS.
Okay, so we need to maybe make a change there, if I'm correct. Let's have those folks testify, and then we'll
I'm not sure we'd
circle
want to
back.
pick a carrier, but I don't know what the right words are, but.
We'll see if somebody, who's first? Josh Mackey's first, 495.
Hey, Josh Mackey on behalf of True Leaf. True Leaf is one of the Class 1 cannabis producers here in Georgia. We fully support the bill and the ease of access it will present patients and caregivers in getting the cards. I think to the question you have, you could replace USPS with mail or delivery service, and I think that would satisfy the requirements and also allow the department to send it securely with their contractor.
We're going to pause here just for a second, please.
Oh, filibuster. Filibuster, and you. My first bill in health, I mean.
Any questions for Mr. Mackey? Okay, and then we had Jenny Helms, Leading Age Georgia.
Thank you, Mr. Chairman and members of the committee. I'm Jenny Helms, president of Leading Age Georgia. We're an association that supports providers of senior housing and services for nonprofits. We think this is a great bill because older adults can benefit from medical cannabis for things like pain, from arthritis, for agitation with Alzheimer's and many other conditions. And it's very hard for some of them to drive to pick up the card. So we think this is a wonderful bill and we ask for your support. Thank you.
We do too, but we want to make sure we do it from a HIPAA standpoint. United States Postal Service probably doesn't do that. We may need to get it certified. We're looking up that statute. So what we're going to do, if you don't mind, we're just going to set this aside. We'll come up with a change, and then we will circle back. You know what? I left off somebody, Edward Lindsay. Might be able to help us with the change there.
Yes, Mr. Chairman, I believe certified will take care of that, and we'll be happy to help you with the change. Edward Lindsay with the law firm of Denton's, and we represent Botanical Sciences. The only thing I want to add to what was already said is that this bill would make sense if a person who needed it could go to any one of 159 public health providers in the state. However, according to the website, and I've looked at it just a moment ago, only 38 of our counties actually are dispensing the cards. So for a great majority of the counties, for people who live in the great majority of the counties, they would have to travel to another county. To give a quick example, Senator Hatchett, your county's not on the list. They would have to go to some other county. But I believe certified would take care of that issue, Mr. Chairman.
Thank you. Appreciate that. We're going to we're going to circle back to that one as we look up the certified mail there, make sure we're appropriate in making a change there. So if you just give us just a minute, and we're going to move on to the next bill, which is Senate Bill 515, speaking of Senator Hatchett. And let's make sure we got the right LC. LC 520503S.
That's correct, Mr. Chairman.
Let me get your mic. Number 3. And we do have a couple folks testify, but you're up first.
All right. Thank you very much. Senate Bill 515 is a product of the Rural Medical Personnel Study Committee that we had in the off-season. One specific need that it is trying to address is the shortage that we're seeing with EMS. In particular, in working with the EMS folks in the state, one issue that we're trying to resolve is the issue of wall time, where an EMS brings a patient to the ER and has to basically wait in the hall up against the wall to get the patient into the ER. We have heard that the reason they're waiting so long is because the ER is full. The reason the ER is full is because inpatient is full. And the reason inpatient is full is because they have patients in inpatient that need to be transferred to another facility that requires EMS. So it's a big rock, paper, scissors game. One thing that this would address, it's creating a pilot program in the state of Georgia where we will have ambulances stationed in 2 regions, Region 2 and Region 8. That's one in Northeast Georgia and one in Southwest Georgia. The ambulance could be used for facility-to-facility transport. And then it also addresses another issue in rural counties when a ambulance is used to transport a critical patient or just a patient in general to, let's say, Atlanta from Hiawassee. That takes the ambulance out of service for about 6 hours. So that county could be down an ambulance and may be down, 2 ambulances or have no ambulance at all. This pilot ambulance would be stationed in a region at a central location, and when an ambulance goes offline in a particular area, the ambulance would be used to basically fill in for that ambulance until the original ambulance returns. And then the last ambulance that we would use is to back up air ambulance teams when they're grounded due to inclement weather or for other reasons. They essentially are, I don't want to say useless, but they're useless because they can't fly in the helicopter. So this would be an ambulance that would they could use instead of using a helicopter. So we've worked with the Trauma Commission, we've worked with EMS. A lot of minds came together to create this, and there is a fiscal impact note that everyone should have a copy of. This is going to basically require for 4 ambulances plus staffing is $4 million for a year, per year, and the total would be $4,116,541.
Any questions from the committee? Mr. Mackey, I think you testify there.
Thank you, Chairman. Different hat on this one. Josh Mackey with the Georgia EMS Association. Just want to say we're fully in support. We appreciate Senator Hatchett bringing this. Look forward upon its passage to working with the State Office of EMS and the Trauma Commission on this pilot project to help solve some critical EMS issues.
Thank you, Mr. Mackey. Any questions or? Okay, no questions. We'll entertain a motion. Motion do pass. Senator Strickland, second. Senator Butler. Any further discussion? All those in favor say aye. Aye. All those opposed, like sign. Pass unanimously. Thank you. So we're on Senate Bill 515, and we just passed. Just finished 515. Are y'all ready? Okay, so we, Senator Watson, I think we have a remedy because of HIPAA, which is health portability, health insurance, something, privacy. I think we all know what it means. I don't know the abbreviations. What is it now? Health Insurance Portability and Accountability Act. So it has to do with privacy related to health, personal care, personal health information, PHI. All right. So the amendment would be on line 27. It would strike the United States Postal Service and would add in certified mail. So registration cards via certified mail was how it would read, or by secure electronic means. So, any questions on the overall bill? Okay. All right. So we're on Senate Bill 495. Need a motion to do pass.
So moved.
Okay. So moved, and seconded by Senator Butler. Senator Butler. And so on line 27, it will be registration cards via, and then we're striking the United States Postal Service, comma, and it will say registration cards via certified mail and continuing on or by secure electronic means. So we have a question?
So the fiscal impact that's on the little sheet
Yes.
contemplates, I would imagine, first-class mail. So that's going to need to be probably looked at
Yeah.
if we're going to do registered mail or certified mail or UPS or anything else. Just saying.
That will certainly probably double that figure, I would presume. Yeah. Okay. So instead of $1 million, we're saying $2 million from a registered mail for the first year, and then the second year will be less. So, okay, all righty. We have a motion, do pass, and seconded for the overall bill. Need a motion for the amendment.
So moved.
So moved, seconded, Senator Strickland. All those, further discussion, all those in favor of the amendment, say aye. Aye. All those favored, like sign. And so now we're on the Senate Bill 495. We've amended it, and all those in favor of this bill, say aye.
Aye.
All those opposed? All righty. So unanimous, and we're moving on to the next bill. Thank you. All right, Bill number 10, Senator Adavitarte, Senate Bill 524. We have no one signed. Yes, we do. Julie Wyndham is signed up to speak, is the only person. And let's make sure we're on the right LC number. We have had some, yes, sir.
The correct LC number, and I apologize for the sub snafus, LC 520506S.
All right, so we need to make sure that we have the right one. Okay. I don't have that one.
Yeah, it should be on this. It should be on this probably beginning of this down, and then we passed.
Okay. All right, I got it. Does everybody else have it? LC 520506S.
Yes, sir.
Everybody have it? Okay. The floor is yours.
Thank you, and thank you for saving the best for last. Natasha and I, we're going to present the Senate bill. I'm just going to kind of hit on the highlights and then just let Natasha kind of just touch on anything I missed and then see what questions you have, Mr. Chairman and committee. The Community Health Worker Certification Act would create a path for certification for community health workers in Georgia, establish accreditation standards for certification, establish a Georgia Community Health Workers Certification Committee to oversee and regulate the certification process. Currently, there is not a state-recognized curriculum for Medicaid, Medicare, And then all the service as it relates to CHWs. This act will develop the CHW workforce, provide career opportunities in rural Georgia, and standardize the requirements to be a community health worker. And that's pretty much it. Just a little bit of background, just from my perspective of why I think this bill is important. It's just as we talk about, the gaps to families and individuals in access to care. Community health workers possess a valuable knowledge and insight into the community they serve. They have existing bonds and trust with many of the Georgians and families, whether in a rural community or even in an inner city urban setting. Community health workers have provided a myriad of services to help their clients navigate the healthcare system. We've seen where community health workers have provided education on the importance of medication adherence as it relates to pharmacy. I know that Natasha and her team have seen a pilot program in Lowndes County, for example, showing annual savings of almost $27,000 per individual because of the educational interventions. Community health workers have made significant strides to support individuals with chronic conditions like diabetes, hypertension, and obesity. And I think as we discussed many times here in the Senate as relates to the workforce crisis we have in the healthcare industry, I really believe that community health workers right now are filling a gap to work with nurses and doctors and physicians and frontline healthcare workers to serve Georgians and getting them into care to improve quality, but also to address a lot of the chronic diseases that we're seeing across the board in the state. I don't know, Natasha, you want to share anything?
Ms. Taylor, you mind introducing yourself and who you're with, and thank you.
Yes, sir, Mr. Chairman. I am Natasha Taylor. I'm the Deputy Director of Georgia Watch. We are the state's leading consumer advocacy organization. We also have led the Georgia Community Health Worker Advocacy Coalition at the request of the Department of Public Health since 2018.
Any questions from the committee? Senator Kirkpatrick has a question.
I hate to keep asking these money questions. Y'all weren't here for the last couple. But so there's a cost for DPH, but there's also potential cost for DCH due to the state plan amendment or whatever way they choose to go. So that's going to need to be looked at.
I'll respond to that. So in the sub, this bill only impacts DPH. Any discussion of DCH has been removed.
That was taken out.
Yep.
Yes.
Just being sensitive to
Ms.
their
Wyndham?
waiver work and everything else.
I fail to recognize Ms. Wyndham.
Good afternoon, members of the committee. My name is Julie Wyndham. I'm with Atrium Health. And we recently did a study of our community health worker program, and I just want to share some stats with you to show you how efficient and effective this program can be. During from November 2020 to November 2023, we enrolled over 2,600 patients in our community health worker program. 77% of those patients were from historically underserved communities such as the African American and Latino communities. And we looked at 6 months before they were enrolled and 6 months after they enrolled to see if the program truly was helping with outcomes and cost. During that time, we found that 9.3% of those patients were attributed to a primary care provider during that 6-month period. Hospital admissions decreased by 47.2% for that population. The total number of ED visits decreased by 32.7%, with total cost of care decreasing by 43.3%. And we reduced our avoidable ED utilization, total number of visits by 24.4%, and reduced the cost related to avoidable emergency deposit visits by almost 30%. So we do think this program is very effective. We would love to see it expanded. We think this bill helps us to do this. I will also mention very briefly, we use community health workers to administer our school-based virtual healthcare program in Peach County, which has been very successful. We would love to extend that to other rural counties, and we think this legislation would help us do that. Thank you, Mr. Chairman.
Thank you, Ms. Wyndham. Anybody with questions? Any questions for the author? Appropriate time is now.
Yeah, I'd like to move to pass on LC 520506S. I hope that's the right number.
Yes.
I think that's it. All righty. Do I have a second? Senator Hodges, any further discussion? Any further discussion? All those in favor, say aye. Any opposed, like sign. Passed unanimously. Thank you. And I have a correction. Thank you. That passes. We'll be going to rules. I have a correction. We had said on the previous bill that the $4 million, 116,5541, excuse me, the DPH did anticipate our change, so there is no change in increase in your pilot project, because they anticipated going UPS, but we did certified mail. Should be the same amount.
Two different bills. 495. Sam Watson.
I'm sorry, yes, okay, so Sam Watson, this one.
Nope, wrong one. This one.
All right, so yes, that's correct. I apologize. Correct again. So the fiscal impact on Sam Watson's bill was $1,041,400, and year two was $573 and beyond, and that was with certified mail, i.e. UPS, what they had anticipated. I apologize about that. Okay. Mike, any? Okay.
Mr. Chairman, I've got a motion to pass LC 520501S. Second. SB 419. Mm-hmm. It's still in the committee. We didn't make a motion. It's still in the committee. It's still in the committee. It didn't pass it. It is still in this committee.
And we'll take a recess, and we'll come back and entertain that.
By Chairman to act as chair, and in my role as chair, this committee stands adjourned. The point I'm making is, in the absence of a quorum, I'm going to use discretion as chair, and we're going to stand adjourned.